This is Healthcare Bill part number 73. We are still on page number 61. And this is rewarding quality through market-based incentives. Strategy described. A strategy described in this paragraph is a payment structure that provides increased reimbursement or other incentives for improving health outcomes through the implementation of activities that shall include quality reporting, effective case management, care coordination, chronic disease management, medication and care compliance initiatives, including through the use of the medical hold model for treatment or services under the plan or coverage. Now, for those of you who have no idea what I just said, quality reporting would be where the health provider gives a report to the health insurance company that the health insurance company can actually read and not sit there and try to translate out of some stupid language. Okay. Effective case management, that means that they aren't giving you a bunch of drugs that aren't going to work in your case. They give you treatments that actually will work and not treatments that won't. Care coordination, that means that the surgeon is communicating effectively with your general practitioner, and the nurse is communicating effectively with the surgeon and the primary general practitioner, so on and so forth. Chronic disease management. This is when they come up with a plan that actually alleviates the symptoms of a chronic disease. They can't cure it, but they can alleviate enough of the symptoms where you can actually go back to work. Okay. Medication and care compliance initiatives. This means that the medicine you're going to be getting is good medicine and not bad medicine. In other words, this stuff will help you and not hurt you. Okay? Alright? And so on and so forth. I think you're finally getting the picture there. The implementation of activities to prevent hospital readmissions through a comprehensive program for hospital discharge that includes patient-centered education and counseling, comprehensive discharge planning, and post-discharge reinforcement by an appropriate healthcare professional. Now, for those of you who do not understand what that means, let me translate for you. Okay, what they're trying to do is when they do a surgery on you and you've recovered from the surgery, they want you to get out of the hospital and they don't want you to come back. Okay, because it's costly having you come back. So what they do is they teach the patient what to do in the lines of taking the medication at the right time and making sure they follow through with physical therapy and that kind of thing so that the patient doesn't have to come back. That's what they're wanting here. And then they appropriately plan your discharge. In other words, they're not discharging you too early from the hospital. That way you don't have a bunch of side effects and you have to come back type thing. And then what will happen is that a healthcare official, whether it be a surgeon or your general practitioner or whatever, he may give you a phone call after you get out of the hospital to make sure you're following up on your stuff, or he may schedule an appointment to have you come in to see him instead of the surgeon, and then follow through with outpatient care. Okay? The implementation of activities to improve patient safety and reduce medical errors through the appropriate use of best clinical practices, evidence-based medicine, and health information technology under the plan of coverage. Now, what this means is making sure that the medication you're supposed to be taking is what you're really supposed to be taking and not something that will cause your symptoms to be worse. You know, they don't want to, they want to make sure that when the nurses are dispensing their medication that they get it right and they don't make a mistake, which cause you to stay in the hospital longer and possibly could kill you, type thing. Alright? And they want to make sure that when surgeons are doing their surgery, that they get all their tools accounted for, so they're not leaving them in your body after surgery, type thing. That's the kind of thing they're talking about there. Alright? The implementation of wellness and health promotion activities. Now what this means is they're trying to get you to live a healthy lifestyle so that you reduce your chances of ever having to go to the hospital in the first place, which I agree with. But you have to keep in mind that there are some things you're just going to end up going to the hospital for. I mean, you break your leg, you're going to go. That's just the way it is. You get in a car crash and you get injured in that car crash, you're going to the hospital. That's unavoidable. Okay? But they're talking about giving you exercise and proper diet so that you don't end up in the hospital all the time with illnesses that you could pretty much keep away from yourself. Okay. The Secretary, in consultation with experts in healthcare quality and stakeholders, shall develop guidelines concerning the matters described in paragraph 1. Okay. Here are the guidelines. Here are the requirements. The guidelines developed under paragraph 2 shall require the periodic reporting to the applicable exchange of the activities that a qualified health plan has conducted to implement a strategy described in paragraph 1. Quality improvement. Enhancing patient safety. Beginning on January 1st, 2015, a qualified health plan may contract with a hospital with greater than 50 beds only if such hospital... Okay, so what happens is that a health insurance company develops a contract with a hospital to make payments and that kind of thing, only if the hospital meets these guidelines. If the hospital utilizes a patient safety evaluation system as described in Part C of Title IX of the Public Health Services Act, and I know you guys are going to want me to look up Title IX of the Public Health Services Act, and I will eventually, because what we're doing here is, well, never mind. Implements a mechanism to ensure that each patient receives a comprehensive program for hospital discharge that includes patient-centered education and counseling, comprehensive discharge planning, and post-discharge reinforcement by an appropriate healthcare professional. Okay, what that means is that the hospital educates the patient before they are discharged from the hospital to take care of themselves so they don't end up going back to the hospital. It makes sure that the hospital discharges you on a good timely basis and not too soon or too late. And also there will be after discharge calling by either the surgeon or the general practitioner to see if you are doing what they told you to do, type thing. A healthcare provider, only if such provider implements such mechanisms to improve healthcare quality as the Secretary may by regulation require. These healthcare providers they're talking about would be like some kind of an in-home caretaker, somebody that actually takes care of you inside your house, that kind of thing. Exceptions. The Secretary may establish reasonable exceptions to the requirements described in paragraph 1. And then they're going to talk about the navigators. And I'm going to stop the video right here because we've gone about 10 minutes and you're probably sitting there going, oh, please stop this right now. But anyway, I'm going to go ahead and talk about navigators in my next video. We are now on page 62. If you are interested, I will tell you more in a future video. Stay tuned.